Hello, I'm Bill Scoggin, son of the late Maribelle Scoggin, and it is with great pleasure that I'm with you today as part of the celebration of the 70th year of Now Caring. As I'm sure folks know, my mother was fundamental in the founding of Community Health Services, Community Health Association, the predecessors to Caring. It was something she strongly believed in, and to say it was her job is selling it short. I mean, it really was her life, and we all were part of that, from the diabetes day camp to helping out at the office to everything, and it was just wonderful. My mother got her start, as you probably have read, going to what was then Women's College, now UNC Greensboro, graduated there in 3 years, and then went on to the University of North Carolina at Chapel Hill School of Public Health. She was the first female graduate of that school with a master's in public health administration. She then became an assistant professor there, in addition to pursuing her career in Charlotte, which was first as the executive director of Heart Services, which was kind of a predecessor to Community Health and Caring. I remember going to Charlottetown Mall and her showing me the offices upstairs. I would later take guitar lessons in the same space. Of course, Charlottetown Mall is no longer, but some of you will remember it. She also had a poster in her office that said, "I have other pies in the oven." And I love that. And the gist of it was, you're important and your problem's important, but there are other people who have much more important problems also, particularly those in need in our communities. And I think that was the point of the poster. I was privileged to have the best mom anybody could have, and learn so much from her, both about what's important, but also about how to do something about it when you need to address a challenge, when you need to help those less fortunate. And so it is a great honor to be part of this celebration, and I am excited that all of you are joining in it.
Hi, my name is Dr. Ashley Carmenia, and I'm the Community Health Equity Director with the American Heart Association, Greater Charlotte Market. The American Heart Association has had a decades-long partnership and shared passion with Caring in improving the heart health of our community. Caring's motto, the heart of community health, is a nod to their founder, who started the organization by going to segregated neighborhoods and offering free heart health screenings. In fact, Caring's original name was even Heart Health Services of Charlotte and Mecklenburg County. In the early years, Caring partnered with agencies such as ours, as well as Mecklenburg County Public Health Department and the Red Cross, to offer services such as a children's heart health clinic, educational events to spread awareness of heart disease and its prevention, as well as even group exercise events at Ovens Auditorium. Over time, Caring began to offer more direct health services and worked with us to establish heart health initiatives for their patients. This has included things like tobacco cessation and participation in our National Outpaced Cardiovascular Disease Program that includes programs such as Target BP and Target Type 2 Diabetes programs. These programs aim to improve control over blood pressure as well as type 2 diabetes, and also to measure and report outcomes. Through a national collaboration aimed at reducing chronic disease, the American Heart Association has also provided Caring with self-monitoring blood pressure cuffs, as well as new mom kits for pregnant women in their programs to help combat the maternal mortality crisis. Most recently, we were able to fund a refrigerator to house heart-healthy perishable foods in Caring's new expanded food pantry. We at the American Heart Association have been so proud to walk alongside Caring all these years as we work together to improve lives and help our most vulnerable population as they improve their heart health and work towards a healthier future. Here's to 70 years and many more, Caring. Congratulations.
Since its founding in 1955, United Way of Greater Charlotte and Caring have partnered together to promote the health and well-being of the residents of the Charlotte-Mecklenburg region. United Way provided Caring its first grant of $16,000 to launch its services. And over the years, the two agencies have innovated and gotten creative together to support the evolving needs of this community. Some examples. Throughout the decades, United Way has been proud to offer funding to Caring's evidence-based nurse-family partnership, a program that provides home visitation services to pregnant mothers. Throughout COVID, United Way provided crucial funding that allowed Caring to stay on the front lines, providing medical care to those who needed it most. And most recently, United Way and Caring have partnered together to provide holistic services around the social determinants of health to residents of the Grand Triangle Corridor. Cheers to Caring's 70th birthday. Here's to 70 more.
Caring. I am Mike Bryant, Mecklenburg County Manager. On behalf of myself, my executive team, and our workforce of over 6,400 employees, I just want to take this time to congratulate you on your 70 years of service to our community. Your organization has stood the test of time and has been a source of refuge, relief, and reinforcement, especially when it comes to providing services for our most vulnerable. As you mark this incredible milestone, I hope you take the time to reflect, recharge, and recommit yourselves to the work that lies ahead. Thank you for your partnership and unwavering commitment to Mecklenburg County and its residents. Congratulations again on this milestone. Happy anniversary.
So I have the good fortune of having worked with Community Health Services, which is now Caring, going way back to 1995. My first job in Charlotte was with United Way, and as someone involved with program evaluation, I actually got to learn which nonprofits were effective in doing a good job and those that maybe needed a little help. Caring ranks high on my list of agencies that have really done an effective job and had a huge impact on healthcare in this community.
Yeah, we've been in Charlotte now for about 30 years, and I have been employed as a surgeon over that period of time, and now have really come to recognize the importance of the social drivers of health and treating patients in their own community in a holistic fashion, understanding their problems, understanding their struggles, understanding their goals. And Caring has always done that. Their nurse-family partnership, their physician reach-out program are both designed to be very holistic programs. That's why we've been very big supporters of Caring over the last 30 years.
Happy anniversary, Caring!
I was the 4th executive director of what was then called Community Health Services, a clinic on East 7th Street providing wellness and health services to some of Mecklenburg County's most vulnerable people. From the time I began my tenure, the board and I realized the organization could do much more, especially for thousands of people who still had poor access to high-quality care. We had a bold vision of deepening the reach and impact of our services, and we believed we could focus our resources more imaginatively toward a more profound effect on the organization and our community. We hired Dr. Firmin-Sellers to be the medical director and the architect of expanding our clinical services. We partnered with Mecklenburg County Medical Society to launch Physicians Reach Out. We moved the agency to the Children and Family Services Center to increase the intensity and productivity of our community partnerships. We brought Nurse Family Partnership to Charlotte, and we established the annual Maribelle Connerat Award to acknowledge our founder's vision and promote our aspirations of amplifying the agency's unique calling. And toward the end of my tenure, we rebranded the agency with the aspirational name Caring to demonstrate that caring for others brought everyone, staff, volunteers, community partners, and patients themselves into a positive circle of healthy belonging. I am proud and humbled knowing that these and other seeds we planted more than 2 decades ago continue to bear fruit today as Caring continues to innovate with one goal in mind: being the heart of community health. Congratulations on 70 years. May you continue to prosper and bring ever more people into your circle of care.
Hi, I'm Firmin-Sellers. I'm the Chief Medical Officer at Caring, and when I was asked to become the medical director here, which was then Community Health Services back in 2002, I felt very fortunate to be asked to join an organization that was serving vulnerable populations in our community. During my time, I have been so impressed with Caring's dedication to those populations and its collaboration with other organizations in the community and its evolution to meet the changing needs of our community. We were able to expand clinic to help bridge care for those without insurance, and we have only increased that capacity over time, increasing from one nurse practitioner to having several part-time nurse practitioners. When we were able to move into our new building earlier in 2025, we were able to expand to develop a 2-generation clinic, which is only the second of its kind in the country. The first is in Chicago, to help mothers and their babies be able to come to appointments during the children's usual child care that usually focuses just on the babies, but now we'll be able to help meet the needs of the mothers better as well. We have such a wonderful group of staff at Caring who are all equally dedicated to the populations that we serve and to improving health equity in Charlotte. I wish Caring the best in the coming years and look forward to continuing to support our mission. Thank you.
Hi, I'm Andrea Flynn.
And I'm Chris Flynn.
And I became involved with Caring about 23 years ago when a colleague of mine from work introduced me to them to join a planning committee for their gala. I then became acquainted with the former executive director and really just fell in love with the mission, the vision, the fact that the donations and monies stay local. When I met Chris, kind of pulled him into the mix.
So I became associated with Caring through my wife Andrea here, having known and wanting to get more involved in the community here in Charlotte. She mentioned that she was associated with Caring, and we went to our first gala together, and that also happens to be where we first got engaged nearly 15 years ago. Caring's been very important to us, not only on a personal level, but also because of the work that they do to support the Charlotte community through all their healthcare work. And we're very happy to be associated with Caring from this day going forward. So happy 70th anniversary, Caring.
Happy 7th anniversary.
I'm Will Hadley. I have been a part of Caring for, I believe, 15 years. And I've served on pretty much every committee and have been chairman and various roles. I think the reason that I have enjoyed and appreciated Caring for all these years and have stayed with them is because I've really enjoyed the evolution of Caring from simply doing several different things for the community, but now doing very major things through nurse-family partnership and physicians reach out, and of course the clinic. And it's just been a real education for me to watch Caring grow and evolve and serve this community in a very unique way that no other company can do, no other nonprofit can do. And I've really enjoyed it. It's taught me so much, and I hope that I've been able to give back through Caring, because they give so much to all our thousands of clients with healthcare and education and many different facets. This organization is always going to be needed, and this organization is always going to be valuable to our community. So I say with enthusiasm, happy 70th to Caring.
Caring friends, I'm Mike Richardson, a physician in Charlotte for the past 35 years. That's just half your age. And the senior program officer in the healthcare mission area for the Leon Levine Foundation. I've been delighted to be able to support you as a physician volunteer through Physicians Reach Out and to steward about $3 million in grants to support Caring since 2009. Caring has been blessed with talented and committed leadership, staff, volunteers, and donors. You always get it. Your level-headed, clear-eyed approach to finding sustainable ways to help others in need is inspiring, making you a perfectly aligned partner for our efforts at the Leon Levine Foundation. Happy 70 years of service.
At Novant Health, our cause is to create a healthier future and bring remarkable experiences to life for our community. And with Caring, that is a critical part to our commitment. I've had the privilege of serving on the board of Caring since 2019. I have also served as a past chair for the Nurse Family Partnership Program. Caring is the first program that I joined when I moved here to Charlotte. Novant has partnered with Caring with Physician Reach Out program since its inception in 2004. Since then, we have worked tirelessly to coordinate with clinicians across the area and to secure different specialties for Caring to partner with. We also work alongside Caring for maternal and infant mortality and to reduce the disparity of women in the community for those who are at high risk. This is through the Nurse Family Partnership Program. This is a program that I hold special to my heart, and I have seen our patients, Caring and Novant patients, go through this journey and see the remarkable outcomes for our patients in the community. Novant also demonstrates support through Caring through conferences like the Maternal and Infant Health Conference, through volunteering at the New Food Pantry, and community-based initiatives through Caring's Bridge program. Over the past 2 decades, Novant has been proud to partner with Caring, and I am so happy to say that we are improving the lives of our community together. Happy 70th anniversary, Caring.
Hi, I'm Jay Kennedy with the Duke Endowment. Pleasure to have some comments specific to Caring. I've had the pleasure of working with the Caring team dating back to when I joined the Duke Endowment in 2017. I can say from experience, they're strong partners in the work of creating access to care for the low-income uninsured. They have been a partner of ours dating back to 2010, long before I came to the Duke Endowment. I've also had the pleasure of working with 2 of their dynamic CEOs, Chernavia Montgomery and Don Jonas. They do incredible work. They're leaders in the space across North and South Carolina. Our scope is North and South Carolina, so I have the perspective of knowing pioneers and leaders in expanding access to care, and they have done just a remarkable job. One thing that I've always been impressed with Caring is their ability to navigate the local healthcare system, and they really nurture and maintain strong relationships with both hospital systems, Atrium and Novant. So again, thank you for our partnership. Congratulations on 70 years and looking forward to 70 more.
When I joined Caring, I was incredibly fortunate to serve as executive director during a time when our community really needed a place like Caring, not unlike the times we're in today. Something that really stood out to me was one of the first events that we held. I was pretty new to the team, and a gentleman I didn't know came up to me and said, "Are you the executive director?" And I said, "Yes." And he said, "I want to let you know that you saved my life." And I was stunned, I was like, what are you talking about? And he said, then he went on to explain the story of how, in this case, Physicians Reach Out helped him in a place where he had nowhere else to go. Our team literally saved his life, and I felt like I was in the right place when I knew I was at Caring. We had an opportunity to help people that were in the shadows and people you don't think about that would not be with us today without Caring. Caring, I think, throughout its history has been an oasis of hope and of believing and of seeing people who are in need. I know when I was at Caring, it was a time of growth for us as we were expanding our programs, and the needs, unfortunately, were high. But I think even we get to today's world, the work that Caring does is just so essential. There's no one else that fills a void like Caring. There's no other organization that can do things and be as nimble as Caring is to address the needs in our community, which unfortunately, due to conditions as they are now and as they are getting, Caring literally has never been more important, and the work that Caring does to serve people across this region. Congratulations, Caring, on 70 amazing years. I'm looking forward to 70 more. What an incredible team of volunteers, board members, staff. Love it. Congratulations. Great job. 70 years. Amazing.
Of all of the forms of inequality, injustice in health is the most shocking and inhumane. A quote by Dr. King in 1966 highlighting his strong stance against health inequities and injustice in our health care system, emphasizing that access to quality-based care is a fundamental aspect of human rights and dignity. 11 years before that poignant quote was uttered, a community health nurse in Charlotte, Maribelle Connerat, sought out on the same journey for justice for those in need. From a thought to a motivation and then action, she took her talents on the road to the west end of Charlotte, where disparities were and still remain great. Our organization has stood fast through a burgeoning heart disease epidemic in the 1950s, then called Community Health Services of Mecklenburg. We were also amidst the struggle for civil rights and equitable health care access in the 1960s, providing community outreach in churches, in housing developments, and neighborhood centers, regardless of zip code, then called Community Health Association. Childhood diabetes in the 1960s with youth summer camps, the fight for equal pay and lawful employment practices with comprehensive medical evaluation for the city's workforce, or when mortality rates for seniors were on the rise in the 70s. We were there. In the mid-2000s, when the maternal mortality rate began to rise, especially for those in poverty, with an innovative solution, nurse-family partnership, Caring was there. And in the late 2000s, when our two major healthcare systems greatly expanded to adapt to the region's changing needs, with a uniquely collaborative initiative, Physicians Reach Out, Caring was there. Over the decades, we've partnered with hundreds of organizations, many of which you, our friends here today, courageously lead. You help uplift Maribelle's vision for equal access for all, decades ahead of laws being passed that defined just what equal meant. Regardless of their race, their ethnicity, their gender, their income, or their zip code, she held firm to the notion that healthcare was a human right. Today, we have preserved her legacy through our core values, safeguarding and protecting our community's most vulnerable neighbors, and the removal of barriers of care, all very unapologetically. To each of you here today, thank you for the many, many ways that you have contributed to her legacy, reminding us that true impact comes from a shared vision and a collective mission. Thank you for celebrating with us 70 years of rich history and a culture of caring. We eagerly look forward and anticipate many more years with you, our friends, by our side, because alone we can do so little, but together we can do so much.